been working on humanitarian issues, kind of working on shock responsive, adaptive social protection, whatever you want to call it. And I have with me here in person Paul Harvey, who probably doesn't need an introduction, but he's co-partner at Humanitarian Outcomes, and he's co-director of the basic research program on social protection in crises. And we also have a great number of people with us today online that will be coming in with country examples. And we have Karis here from the ILO. I'll be introducing them later as they come into the session. So I think we can probably get started because this is more informal. Have you ever received social protection? This probably is a group of converts to some extent. You can see that a lot of you have said yes. There's a few of you that I appreciate for your honesty. You've said, I'm not really sure, have I received social protection or not? The next question here probably is not as useful, given a lot of you have already said yes. Are you likely to ever receive support from a social protection program over the course? Or have you ever received at this life course, given that definition of social protection that I was showing? So again, we've got a lot of yeses, which is great, which means that a lot of you actually understand what social protection is, which is a great start. I'm going to just let you, I've got 19 yeses, 22 yeses, definitely a lot of people understanding what social protection is. So for those of you who might still be in doubt to some extent, up here you've got your typical life cycle. Here we have a sort of comprehensive family on families. There you have your pregnancy, early childhood development, childhood, youth, active age, adults, disabled, elderly, and we have our covariate shocks that are compounding life cycle risks. And social protection broadly, a lot of us think of it as falling under four main categories. So we have our social insurance, contributory social protection, we have our pensions, for example. That's why we are all potential future recipients of social protection. A lot of us in countries that have invested in contributory insurance, have pensions, have benefited from maternity leave, have benefited from a lot of these protections from an insurance perspective. There's a wide number of programs which fall under the social assistance category, kind of cutting across the different stages of the life cycle. Depending on the country that you're living in, we have quite a number of complementary social care services type programs. And some of us, for example, the bank kind of include active labor market programs within the categorization of social protection. So it's not about us and them, poor people receiving social protection. We are all potential beneficiaries of social protection. And ideally, we'd want to be seeing an increase in coverage of social protection globally to be addressing life cycle risks compounded by covariate shocks. So before I go to this slide, let's go back to the Mentimeter, to the next question. So is the social protection sector underpinned by principles similar to the humanitarian principles for humanitarians? Is the social protection sector underpinned by principles? So over to the audience, both online and in the room. So we're all very familiar with the humanitarian principles. What might some of the principles for the social protection sector be? I really like seeing some people admitting to not being really sure. That's fantastic. So we've got a majority of yeses, a few no's, and a nice number of people who aren't really sure about this, which is good. Let me just give you another minute or so to answer. We have about 23 responses. The people who are not sure are increasing here. Let me just go back to the presentation, and the answer is we don't necessarily refer to them as principles, but they are principles. And in fact, if you look into some of the core sort of underlying literature looking at social protection is a human right embedded in the Universal Declaration of Human Rights. It is deeply embedded in the SDG agenda. It has a set of principles, kind of very explicitly explained in ILO Recommendation 202 on social protection floors. And just about a few weeks ago, there's been a fantastic fact sheet that has been published by the ILO and the United I can never get the acronym right, for human rights, looking at the right to social security and how we can think about principles for social protection. And of course, for those of you who are humanitarians, there's a lot of the principles on why should we be using social protection kind of embedded in the grand bargain and some of the kind of humanitarian facing kind of international agreements, and we'll be coming back to this later. So back to the Mentimeter. So have your phones ready. We're going to be going back and forth a few more times further down in the session, not now. I think this is the last one now. Are the objectives that social protection is trying to pursue similar to those that are pursued by humanitarians? Yes, no, not really. Once again, I'm not really sure are the three answers for you. So we've got a bolder yes response here. Fantastic. I can see 19 people have responded. We've got kind of that broadly is important. So broadly, yes, obviously kind of that there's not full coinciding of objectives, but if we look at what we're trying to pursue in the social protection sector, we're trying to achieve increases in coverage in terms of those compounded by covariate shocks, so that we're fully meeting the multidimensional needs of people, and we're trying to increase the comprehensiveness of the different types of programs addressing those different risks and contingencies. So that's why we're looking across pillars, we're looking across a range of very different types of programs. And in the background, we're trying to ensure the quality of the overarching system, and that includes all those principles we were saying before about non-discrimination, equity, inclusiveness, etc. And this visual you might have seen. If you haven't, you can find it here in the Social Protection as a Solar System brief. It's very short. It's just telling you when we think social protection sector, we think how to build this strong, sustainable, institutionalized system that can be serving people over time. And we're doing that by building up the legal and policy framing, the domestic financing ideally for it, functional and technical capacities, those workers working at the frontline workforce. And then we're looking at lots of those design elements, which you'll see completely coincide with a lot of the design decisions that humanitarians are facing around transfer levels, around targeting, etc. And then on the outside, we've got what we as a sector call the delivery chain, but that completely overlaps as well. And as you can see that the entry points for connections are already starting to appear with the humanitarian sector. So that's where I close with this kind of intro, just to start us off. I'm going to hand over to Paul, and you can probably use this since you might have more flexibility than I do.
Possibly.
Yes, let me do. I'll do it for you. Yeah.
Okay. So thanks everyone. My name is Paul Harvey. I'm the Partner of Humanitarian Outcomes, and yeah, working on the basic research program. I think of myself as a humanitarian, so this title, what should humanitarians know about social protection, I think was my idea. And I started thinking about humanitarian cash about 20 years ago, and thinking about when we should give people cash instead of food aid or buckets, having given people food aid and buckets, and just come back from having spent 3 months in Tajikistan trying to figure out how to get 30,000 blankets into Afghanistan, and thinking it would be easier to give money to people in Afghanistan. So it started from a humanitarian point of view, and how should the humanitarian systems shift from giving people in-kind assistance to cash assistance for me? And I gradually woke up to social protection, partly because I was doing research on the impact of HIV/AIDS and how humanitarians should respond to that. And a lot of the answer to that was social protection should respond to that. It wasn't really a humanitarian thing. And so in recent years, I've been looking at how humanitarian actors and social protection actors should relate to each other. I'll talk a little bit about that. So the first thing humanitarians should know about social protection is that there's a lot of it in humanitarian crisis. The World Bank portfolio figure up there is not yet off the press. So this is subject to change. The World Bank is developing an approach paper on its approach to social protection in situations of security, conflict and violence. And its current calculation is that its current portfolio is 11.5 billion. So that's part of the reason you should care, because in a year in which the humanitarian systems budget might shrink from 30 billion to 15 billion, 11.5 billion of social assistance in crisis is important and shouldn't be ignored. And in lots of humanitarian crises, existing social protection is really important. I've put Iraq, Ukraine, Somalia up there. Not everywhere, there's lots of places where it's more nascent, but in a bunch of the protracted crises where the bulk of humanitarian assistance is programmed, there is important social protection. In thinking about links between humanitarian assistance and social protection, this isn't a new issue. Lots of guidance is becoming available. SPIAC-B has developed common principles and is in the process of developing tip sheets.
No, tip sheets are out and ready. You can Google them and find them. They're online.
Okay.
Yeah.
Tip sheets are all out. WP strategy on social protection is out. UNICEF guidance is being written by Valentina as we speak. And the World Bank approach paper will be out later this year. And FCDO convened a big forum in the autumn last year, talking about social protection in conflicts held in Rome, and hopefully will survive FCDO cuts. They're convening a high-level panel on social protection in conflicts that will be happening over the next 6 months or so. And then the but, this is I think my final bit, yeah. So, you know, despite the fact lots of guidance is available, despite the fact it's really important, despite the fact that this isn't a new issue, there are still, I think, problems with the ways in which humanitarian actors think about and relate to social protection. And part of it is just too often setting up parallel programs, failing to explore ways to link, withdraw, or support national social protection systems. Ukraine was actually a classic example of this, where just far too many parallel humanitarian caste systems were set up in a situation where it was sort of obviously daft. And too often humanitarian principles are being used as a sort of knee-jerk excuse for not thinking about how you should relate to national social protection systems. There isn't sort of reasoned thinking about how principles mean that it's the work of government. It's used as a sort of excuse for not thinking about it. And then the third point, now clearly there are important data protection and privacy issues in what humanitarians are doing, and in situations where governments are parties to conflicts and engaged in serious abuses of human rights. Humanitarian actors need to be very careful about data. But too often humanitarians are developing sort of proprietary systems for the ways in which they're providing assistance to people, and again are using principles as sort of an excuse for failing to think about ways in which it might or might not be possible to responsibly share data within across government systems. And in a bunch of places, governments have shared data with humanitarian actors, and humanitarian actors are refusing to share it back again in ways that just are problematic and exploit linkages. We can talk about that more later, but I'm going to hand back to Valentina.
Fantastic. So just to again get us going on how this session is going to run, we've done this sort of brief introduction. We're now going to go through a few mythbusters quickly, just to kind of clear the air. And we've got some handouts for you in the room, and on the chat, we'll be handing these out virtually for those of you who are online on kind of the social protection and crisis myths. And there's going to be a publication that comes with this, which is longer, which has examples for each of the myths where we show how there's many countries where a lot is actually happening beyond maybe what we're aware of. Then we're going to have 4 country examples and a comment from Karis, who's going to be looking across. And then we're going to have plenty of time for discussion and sort of voicing doubts, voicing concerns, voicing other examples, and thinking about what this means for us as practitioners. So swiftly, let's go to the myths. The next question that you find in your Menti is: using social protection systems to deliver emergency cash slows things down compared to usual humanitarian aid channels. Is this true, or is this myth? Maybe I shouldn't be popping this up so you're influenced by prior responses. Slows things down compared to usual humanitarian aid channels. I'm going to give you a few seconds to be clicking on that. And Paul, I'm going to hand over to you then to comment on kind of what we've been finding.
Yeah, sure. We haven't set this up interestingly, so the answers are going to be a surprise. The evidence from STAAR and BASIC suggests that this is often a myth. Now, these things are never completely black and white. There can be times when humanitarian systems are responding to crisis, and trying to link the social protection system can take time. But in many places, especially where social protection systems already exist, they can be particularly timely and effective. I was doing a review of the response to Pakistan floods a couple of years ago, I guess now, and there the World Bank was able to repurpose an existing loan and get money through an existing social protection system through the Benazir Income Support Program and the government of Pakistan much bigger and a much bigger scale than international humanitarian actors. And yeah, it blew the humanitarian system out of the water in terms of sort of speed and coverage. And COVID's the other classic example. If you really need to support people at scale and fast, then there's kind of no substitute for governments, and that's what is listening up.
Yeah, and the number of examples globally are just skyrocketing. And the reason they're skyrocketing is because more governments are being accompanied in the process of thinking through this in advance. How can they think about those recurrent, predictable shocks that they have in country and how they might be addressing them swiftly by building up systems to do that? So the effort kind of that our community has made in recent years has been paying off in recent years, with the Kenya Hunger Safety Net program being one of the most cited examples, Ethiopia PSNP as another one. So going to the next one, social protection systems can be designed to be very flexible and able to adapt in response to acute shocks. You can see we're playing around with words here. There's an emphatic very flexible and able to adapt in response to acute shocks. Is this true or is it a myth? So thank you to those of you who are trying to push the balance towards not all answering the same thing. Okay, quite a few of you here feel maybe that emphatic very might be raising some question marks, and that's good. 20 of you have answered. I think I'm going to hand over to Paul.
Sure. So, I mean, we do think it can be flexible. It certainly can be flexible in response to natural shocks, and that's where much of the experience in literature lies. And you can sort of build in, and we've been hearing this morning in sessions on anticipatory action about triggers. You can build in sort of the ability of social protection to respond to drought or floods or predictable shocks. But it's also interesting, I think, to think about ways in which it can be flexible and adaptive and able to respond to conflicts, which after all is where most international humanitarian aid is spent in protracted crises. And Gaza is a really interesting example of that, where the World Bank, EC and others have been supporting the Ministry of Social Development in West Bank and Gaza to develop a social registry as part of the social protection system. And in response to post-October 2023, they were able to develop a short intake form that registered 360,000 people and has enabled UNICEF to provide cash to people through the current conflict. And that's, I think, a really fascinating and valuable example of ways in which the sort of prior investment in systems can help to flex and adapt to conflicts, even when it's not possible for government directly to continue providing assistance to people. The systems can help to support an international response.
And we are going to have Momin Badarna joining us from OPTs to just discuss more broadly how coordination across the nexus has helped to kind of forward that agenda in the occupied Palestinian territories. Let's move to the next one. Working with governments goes against the humanitarian principles of neutrality and independence. Obviously, we've been touching on this already a little bit. Working with government goes against the humanitarian principles of neutrality and independence. Just waiting to go beyond that 20 mark. That makes me feel like we've reached, obviously it's not sufficient. I'll be sharing the results afterwards, kind of just to see when we okay, we've definitely got a winner for the myth side, but we've still got a few people saying this is true. Over to you, Paul.
Yeah, I mean, clearly this is a complicated one, and get a bunch of humanitarians in the room, they can have a long argument about principles. And in the Rome Forum last year, there was big arguments about principles and the extent to which humanitarian principles made it problematic or difficult to engage with governments, particularly in conflicts. I think there's lots of things that are important to remember here. One is the sort of the fact that embedded within sort of humanitarian principles and UN 46.182 and so on is the primary responsibility of the state to assist and protect, the idea of the Red Cross playing an auxiliary role to government. And so neutrality and independence isn't a sort of set of principles that mean you shouldn't engage with and think about how to work with governments. There are a set of principles that force you to think about ways of principled engagement with governments and what that means in situations of conflict. And so, yeah, I mean, I think that lots of organizations trying to support people in conflicts in particular have both humanitarian and development mandates. They're committed to social protection principles and to humanitarian principles, and they need to think about how those things, can be reconciled and what that means for how you support people in crisis.
I think one of the most shocking to me was when I reread, I'd always heard of them, but I hadn't gone back to the source, the 2011 Principles of Good International Engagement in Fragile States and Situations from the OECD. And there's kind of whole sections on not undermining national institution building, making sure that the do no harm principle is also do no harm to existing systems that are there to serve people in need. So again, we need to be thinking about how those principles translate when we're thinking about supporting government systems and long-term action.
Yemen's really interesting here. So Yemen is clearly complicated, divided government. One of the governments has been designated as terrorist. A government that's arresting aid workers and killing some of them in detention. But on the other hand, there's a parastatal organization, the Social Fund of Development, that's been able to successfully work on both sides of the conflict for the last 10 years, delivering social assistance to people. It's parastatal, its boss reports directly to the Prime Minister, but so it's in some sense governmental, but itself has been able to maintain a degree of sort of technical neutrality that's enabled it to work on both sides of the conflict. So these aren't simple issues. So they're really difficult issues that you need to think about on a case-by-case basis on the way in which you can and can't engage with what bits of government.
This is coming out strongly from the basic research, from the STAAR research, the fact that we're thinking about government as a unitary entity doesn't make sense. Let's break it down. Let's think across different institutions. Let's look at the technical state capacities all the way down to subnational levels of engagement. So just again, when we say engage, that's what we mean. It doesn't mean you are working with whoever is party to conflict. You're working with those who are not party to conflict. Maybe they're actively against the people in power who are. So we can be kind of working across all of that, as long as we're, again, conflict sensitive and aware. So last myth that we're going to be dealing with, there's a few more, and there's a longer accompanying note. I'll be sharing these in a minute. The last one, it is always possible to engage with governments or government social protection systems in settings of fragility and conflict. And again, we're kind of pushing you here with that always. It is always possible to engage with governments or government social protection systems in settings of fragility and conflict.
This one maybe.
Let's see if I can push you off the bench with this one. Bench fence.
Again, it's a tricky one, and the always one makes it hard, doesn't it? There may be situations in which there's very little existing social protection systems, so it's difficult to engage, and then maybe it's places where it's really, really hard to engage with governments. But I guess this kind of cycles back to the previous point. Both humanitarian principles and everything else are an argument for principled engagement with governments, and governments are unavoidable. They're sovereign states. You have to register with them whether you like them or not. They give you permission to operate in a country, and so everywhere and always you need to think about how you engage with government systems as a humanitarian actor, and in providing cash or food assistance, you think about how you engage with social protection systems, even when it's not possible to work directly with governments. And I think that Yemen is an interesting example. Sudan's the other interesting example. Obviously, it's really, really hard to work with government in Sudan at the moment. But the World Bank has just got funding for $100 million worth of social protection to run in Sudan for the next few years. They're working through what they call third-party humanitarian agencies and other people called UNICEF and WFP, and mostly at community level. But as that program continues, they will be thinking about how you relate to government and line ministries and the technical capacities of government.
Amazing. So basically, we can always engage, but engaging might simply mean understanding what is possible and what isn't, having that stakeholder understanding of who the stakeholders are at different levels of government, understanding what social protection programs are in place. Is there a right to social protection embedded in the constitution in this country? Can be working with that and with advocacy groups to be pressuring. So there's a lot that we can be engaging with. It doesn't necessarily mean that we're working through governments. There's many third-party arrangements and other ways that we can be doing that. So I'm going to come to the country examples. We're spot on time. We've got 6 minutes for each of our speakers, which I know is a bit nasty, but I really want to have a full half an hour for the final discussion. So first speaker is Momin Badarna. He is Social Protection Coordinator for the ILO in the occupied Palestinian territory. So over to you, Momin.
Hi, Valentina, can you hear me?
So I can hear you. I need to see if I can find you. Oops. On the visual here. But do start speaking.
Yeah, thanks, Valentina, and thanks, colleagues. Good afternoon and morning to everyone, wherever you may be. So this is Mo'min Badana from the ILO. I'm the Social Protection Coordinator in Palestine. And I would like to really try to complement some of what has been mentioned in this very useful presentation by the way today, in terms of showing some country examples of how and how can the social protection system be leveraged and or coordinated with by other agencies, of course, including the humanitarians. So for this case study, it will be Palestine, including the West Bank and the Gaza Strip, which, as you know, have been suffering from a protracted crisis, but also a severe humanitarian emergency since the events of 7 October. So in response to some of the questions that have been and the statements that have been presented in this presentation, I would like to start by saying that in Palestine, there is a coordination group called the Social Protection Cash and Voucher Assistance Thematic Working Group, which composes humanitarian and development actors, through which we discuss together and try to find operational synergies and programmatic coherence between social protection and humanitarian operations in cash and voucher assistance. So under the work of this group, I think partners were able to some extent to leverage some elements of the national social protection systems in different ways, in a manner that allowed for a more timely and coordinated response, but also to support building and strengthening the national social protection system. And this mainly was the case, of course, in the Gaza Strip, and to a less extent as well in the West Bank. So just to show some concrete practical examples of how these elements were leveraged by the humanitarian agencies in Palestine, I would say that we had noticed an increased use of existing national mechanisms by a number of humanitarian agencies, mechanisms such as the Ministry of Social Development Social Registry, which also includes emergency data collected by the Ministry of Social Development after 7 October. So this social registry has been used by some humanitarian organizations to target beneficiaries and provide immediate assistance in the Gaza Strip. This helped, of course, in terms of providing timely and immediate response, capitalizing on a nationally collected data. And we have different partners such as the ILO, UNICEF, the EU, the World Bank, who played as well a pivotal an important role in supporting the information management capacities of the Ministry of Social Development to empower the ministry to collect data which humanitarians could use whilst responding to the immediate needs. Of course, in addition to data collected independently by other agencies. So here we have two set of lines. One is really using that data to provide immediate assistance, but also helping the Ministry of Social Development and the national system to collect more data to verify it wherever it may be possible. Of course, this comes with risks pertaining to data privacy and protection, and this came up as well in the presentation, and I think we need a whole session in this particular issue. But we had different consultations aimed at drafting and signing data sharing agreements between the ministry, between the national systems, and other cash actors. Up to this date, data sharing agreements have been signed, for example, between the Ministry of Social Development, UNRWA, UNICEF, etc., while other partners are following suit. Of course, this is important to allow for a timely response that respects the privacy and dignity of beneficiaries, as well as humanitarian principles in doing so, which is very, of course, important and issue that always come up on the table. Going forward as well, a number of humanitarian and development partners will be supporting and updating the verification of these nationally collected data, which I just talked about. So this data was collected throughout the emergency period by the Ministry of Social Development, and now there is an attempt to have this caseload transit into a permanent national social protection caseload that could be integrated into the national social protection system, and to, of course, expand horizontally and enhance sharp responsiveness of the sector as a whole. This is a joint collaboration as well between the humanitarian actors, or some of the humanitarian actors, and the national authorities. One important dimension is related to the implementation of humanitarian assistance, but also the social protection system, which is the payment through digital e-payments or e-wallets. So another dimension is related to the opening of e-wallets to national social protection caseload and beneficiaries by the humanitarians. So those humanitarians who have capitalized on the data of beneficiaries provided by the Ministry of Social Development, these humanitarian agencies have facilitated the opening of e-wallets for those beneficiaries. And of course, this would in the future contribute to the readiness of the national social protection system to disperse social protection benefits through digital means, and to support the national system to disperse social protection benefits once again in the Gaza Strip. So this is, of course, another important point, another example as well, how humanitarians, they use their emergency operations and the ability to pay through digital wallets to as well equip the national system with a more, let's call them more ready beneficiaries to receive their payments as well via digital payments. And maybe here one last point is that there was as well an alignment of transfer value of emergency multi-purpose cash assistance, or EMPCA, between the cash working group in Palestine and the Ministry of Social Development and the Ministry of Labor, where the latter government partners have agreed as well to use the same transfer value adopted by the cash working group for their emergency cash assistance operations under the National Social Protection System. So this was as well a very important dimension. Of course, all of the points that I have just mentioned come with challenges. I'm here trying to be very much brief and concrete, direct to the point, but this did not come with challenges. There are way more aspects pertaining to humanitarian principles, data sharing, the ability to engage with government partners that will face an obstacle to the implementation of humanitarian assistance, but also to supporting the national social protection system. But maybe one important point that I want as well to mention before I close off is, regardless, or while such experiences and progress come with challenges, I believe that there is an existing and perhaps a wider space than we think to link emergency response to national social protection systems, to coordinate with the system, to leverage some elements of the social protection systems and the national capacities. And when I look at the title of this webinar, why should we care about social protection? I also think that it's really important to differentiate between political entities and administrative national social protection systems. What I mean here is that the administrative national social protection systems must probably continue, even if political entities change, even if a regime fall, etc. And this is why I believe we need to support and strengthen national capacities and continue the investments that a lot of development partners, a lot of donors have made in social protection systems before. But also this could and it should be linked as well to a more holistic approach that goes beyond as well cash transfers or cash for work, etc., but also links with the broader strategies maintained at the national level, including employment strategies, programs, social insurance, health protection, etc. All of these policies should be better linked, integrated in a more holistic approach that, that protects people throughout the life cycle. And I think only by adopting this approach, we can have a higher probability of coming up with a more inclusive and sustainable social protection systems that are able to reduce as well pressure on the humanitarian agencies during shocks. Over from my side.
Thank you so much, Momin, and thanks for making that point again. There's a reason why we call them civil servants, is that they're serving us as people working living in the country, not whoever's in power at that moment in time. So handing over swiftly to Hashim Zaidi, he's Regional Social Protection Specialist. We're staying in the same region, UNICEF MENARO. Over to you, Hashim.
Yeah, thanks, Valentina. Yes, I will. I'll keep track of time, hopefully. And if I go long, please do cut me in.
Yes, I need to find a way to do it correctly.
Yes. Thanks, and good afternoon, colleagues. So I think I was going to actually talk about two examples. I was going to talk about Yemen and Lebanon, but I think in the interest of time, let me focus in on Yemen. And I think it's better to maybe talk about how the system was leveraged, for the humanitarian crisis. So if you look at Yemen, in terms of social protection, the agenda was led by the Social Welfare Fund, which was established back, I think back in the 90s, and then there was a lot of investment that had gone in through development partners, primarily with the World Bank, which had worked closely with the Social Welfare Fund to invest in designing their flagship social protection program, the unconditional cash transfer program. A lot of system strengthening work, and other agencies, including UNICEF, had worked with it. And this is all prior to the conflict in 2015, right? So during this time, there was a lot of investment that had gone in, that had looked at, developing operational readiness for the system. And then when the crisis struck in 2015, of course, there were red lines with, transferring funds to government entities. And that's when, the bank exercised the third-party implementation modality, and UNICEF came in to support the delivery with a national partner, Social Fund for Development, which was absolutely key to the delivery of the program. Now, when we look at the overall program, what were the aspects of the existing national social protection system that were leveraged to do this response, right? So one was, which was critical, was the social registry. The beneficiary database that existed predated the conflict, and there was a functioning management information system that was used to obviously continue that program. That was one. Number two was around the benefit amounts. The benefit amounts were similar, along with the operational guidelines, and the targeting criteria and everything remained the same. So the systems that were there prior to the war sort of continued even after the war. Then the most important one was around human resources, because traditionally this program was being implemented by Social Welfare Fund, which was a government entity, and now there were red lines around engagement with the government entity. But this is where, and I think this comes back to, Valentina, what you and Paul were referring to earlier. How do you disengage at maybe the highest level, but maybe there's a way to practically engage at a more operational, localized level? And I think that's the approach that was taken by UNICEF and by SFD. And then lastly, I think it was also to do with payment mechanisms. Prior to the war, there were certain financial service providers, including the postal office, which we couldn't use after the war. But the other ones we were able to leverage and continue working through them, so that assistance that people were receiving, they already were used to some of those payment instruments and payment partners as well. So there were multiple aspects of the system that existed then, where the investment had been made, and then they continued to support the response after the war. In terms of when we talk about, for example, the risks, I think the biggest risk is, and there was a question around this, it's with the engagement with national actors, because, due to various considerations, and compliance, particularly for UN agencies and humanitarian actors, compliance with sanctions, money laundering, all these different regulations, it has become a big challenge. How do you ensure maintaining or building that national and localized capacity? And I think that continues to be the biggest challenge. And these regulations keep on getting updated, and it's something that you have to keep on checking in terms of how you're operating and how you're implementing. And I think one of the ways that we learned, particularly in Yemen, was how you could continue to work through maybe a localized structure through a strong national partner, which continued to be Social Fund for Development. So there was a way to implement through a national partner, and then some of the existing local structures in a way which was still possible. So I think that was key, even though it posed a big risk. I think the second thing is, around the ownership. At the end of the day, it is a national program, right? So when you're working through a national social protection system, the idea is that it is meant to have national ownership. But when there are issues around, the national authorities being parties to the conflict, of course, how do you ensure their engagement to continue having that ownership? And I think there's a very fine line of how you do this. And I think UNICEF, the bank, SFD, and others, we've continued to find a way to sort of engage with social welfare fund at a more operational and a technical level, rather than at a more political level. Because I think at the end of the day, we all need their permissions for access, their permissions for implementation, and there are ways that you have to do this. And these are risks that we continue to face. And just to conclude, I think things that we could continue to reflect on when we talk about why is it better to implement through a national system. I think it's all about sustainability, and particularly in the day and age, in the current setting, it's even more important, because we all know the moment the humanitarian funding ceases, a lot of programs just shut down. But if you reflect on the Yemen experience, and this is a credit to everyone involved, including the bank, SFD, UNICEF, and other actors who were involved, I think that program has sustained for a long period of time. And currently, we're looking at the second iteration of the program, where we're trying to revise the targeting formula, looking at how to make it more impactful. But I think it's about that sustainability and ensuring that ownership and building those local capacities that then ensures that sustainability will go beyond when the humanitarian funding sort of ceases. And then I think what's important is, during this process, how do you make sure that you are still contributing in some ways to working with national actors? Because I think at the end of the day, third-party implementation will go away, right? And there always has to be that transition back plan, which might not necessarily be, in the interest of agencies who are actually implementing it. So how do you ensure that there's a robust plan available to transition it back to the national system? And I think that's why some of these interventions, if they're done through the social protection system, can be a bit more sustainable and long term. I hope I haven't exceeded my time. Let me stop here. Thanks. Back to you, Valentina.
Fantastic. Thank you so much, Hashim. And what I'd like to say here is there's a fantastic case study of everything that Hashim has been speaking to in Yemen, which I think is already available online. Charlotte and others who are online, maybe you could start sharing it in the chat. Otherwise, you could go to the STAAR website. It's one of the key case studies that we're looking at of social protection in conflict. And you speak to that important, what happened in Yemen was looking at the trade-offs, understanding there are trade-offs, and mitigating the risks that are emerging from the trade-offs head on, rather than running away from them and saying we can't engage because there is conflict. So again, another quite intense conflict situation at the moment. We're handing over to Lukas Wyborski in Ukraine. Lukas has been team leader for the Pedikid initiative, which has been quite key to coordinating across humanitarian and social protection and government focus. So over to you, Lukas.
Thank you, Valentina. Great. So I'll try to, just a second. I'll try to be succinct, but I have slides, so let's see how that goes. I wanted to start first with a bit of a context. So in Ukraine, what we saw and how we actually looked at it was projecting this as linking stages. So basically starting from where usually we start, which is that we are not considering the social protection system in our programming as humanitarians, which basically then goes through other stages, understanding it, aligning, and then really interlinking, making sure that we are getting the best of the two and that we are really complementary, like in line with the new ways of working from the humanitarian summit of 2016. So as in most of the contexts, we started with humanitarian partners just setting up standalone structures as usual, with minimal links to the social assistance and other social protection programs. And it was actually the impetus for starting the Pedikid initiative and building some understanding alignment analysis between the two. Where are the strong points? Where are the gaps? And soon discovering that it's also a question of mutual understanding, the understanding of the social protection system by the humanitarians, but also of the government, of how we work as humanitarians in our global standards and global structures. So that was the next step. And then, of course, walking a little bit more to alignment. So how we can piggyback on the government systems when it makes sense, when it doesn't make sense. And where do we actually talk about this? Because it's a cross-cutting topic, a little bit like cash is. So in that sense, it's disruptive. We cannot really, put it in one cluster, but it affects all. So the role, and I think this was mentioned before today, of the ICCG and of the HCRC was discussed multiple times, how this could be the catalysts for this discussion to be on the table and to be considered at face value. And then what it went to was we started talking about the social protection lens in humanitarian programming. So considering what is available when we are determining trends and values, but when we are also targeting aid. And then, of course, the interlinked stage, ideally with interoperable systems and looking at where the social protection system is best positioned to respond and which needs it responds to and where should we go as humanitarians. This is what we found in the beginning. So basically, the systems being slightly misaligned with different registration and enrollment points. Some of the social protection programs having relatively lead times, which of course is then the humanitarian niche, trying to be really fast, which actually translated into the cash being now delivered within 5 days as a guidance from the cash working group, which I think is quite impressive considering in other contexts it sometimes takes long time or we do it in batches. And then general things that are related to, of course, the issues in the system. Every system has some access barriers. We should be aware of them and try to overcome them or program in a way that we align our humanitarian programming with these barriers. The system is quite comprehensive in Ukraine. This is just a quick snapshot. We see that there is tens and tens of programs covering different age groups and different conditions, and it's also fast. So we basically saw the government responding within these time periods to different external shocks, so to say, like restoration of payment systems or sudden explosion of the Kakhovka dam in Ukraine. How quickly it took the government to organize their own assistance. So it shows that in this kind of context, government is a strong emergency responder. And now a bit more, and I will stay on this a bit longer, the good practices or the takeaways. So in Ukraine, the government set up a self-registration platform that basically was instrumental to scaling humanitarian cash because it was very quickly able to gather a lot of data and to share it with humanitarians for multi-purpose cash assistance. The piggybacking programs in Ukraine now count about 184 million that were delivered through basically using the government lists or piggybacking on existing programs, but effectively getting government data, then deciding on what is the right strategy, how to work with this, and then assisting. And there is quite strong emerging systematic linking of the humanitarian caseloads with the social protection system, trying to just support people in getting the entitlements that are due. Of course, we are in a context where the government is not persecuting its own citizens, so the questions of data sharing, linking, they're naturally like low risk. But despite that, of course, we see also protection risks, for instance, for men in conscription age that simply don't want to be seen by the government systems because they are worried they will be taken to the military. We saw, and this is, I think, good takeaway, really like recognizing the piggybacking structurally in the HNRP and in the cash working group as a modality of the aid delivery. Because in the beginning, there was a little bit of, oh, should we use the systems? What is the risk? This is not humanitarian, but recognizing this is simply a modus operandi for responding to humanitarian needs. Then there was, I think, policy-wise, quite a breakthrough. And there were some preconditions why this actually worked relatively well. The government systems were there and they were relatively fast to set up because they existed. Some of the programs existed before the full-scale invasion, and that enabled the government to deliver these impressive numbers in 22 and 23 between $1.5 and $2 billion. And this is just benefits. This is not overhead. But what's interesting and what I find quite a good takeaway is that when we look at this scheme here on the right, then here where social protection system overlaps with the humanitarian system, that's where the needs can be well targeted. I'll get there just in a minute. First, some rough comparison. So we see that the cost efficiency of the social protection system is extremely high. The economies of scale are impressive, which is not surprising, with about 98.8% for an IDP assistance program in 2022. Of course, we see higher cost efficiency than we can reach as humanitarians, but there's buts. So there can be inclusion and equity considerations, and which means that in some cases, and this is the case, this could be a very good instrument. The instrument where the people are already in registers, they are already there, they are already receiving benefits such as child benefits, pensions, or maternity benefits. And if these people happen to be in a humanitarian situation, of course, we can deliver to them much more cost efficiently, and we can use that also for targeting. Whereas in the case where they are not there, this is the prime space for sound complementarity, basically looking at those excluded as those facing barriers and those that are just facing shocks, because then the response has to be rapid, and that's usually one of the downsides of actually working through the social protection system, that it may have lead times. So to us, these are the key takeaways, but also risks when looking at it from perspective of when would it make sense to use, when does it make less. So that's it from my side. Thank you. I will stop here.
Amazing, thank you so much, and thanks for stressing that the cost effectiveness dimension. It's one of the dimensions that we have in the myths, and also going beyond just cost efficiency, cost effectiveness, but also the broader value for money, looking at the quality as well, and complementarities that we can have there. Turkey is always an example that we use on this, how the ESSN kind of was very much kind of a large majority of the channeling was happening through government systems, but there was a complementary role for humanitarian actors, that the Turkish Red Crescent played a big role in that last mile support, bringing people to registration points, helping to do the translation, helping to make sure that those facing the highest barriers to access were able to access. So again, thinking about complementarity in breaking it down, not just thinking, yes, we link, no, we don't link, yes, we do social protection, no, we don't do social protection, but thinking across the various ways in which we can be connecting. So I'm going to pass to Jimena Peroni, who's going to give us a regional overview from Latin America and the Caribbean. She's our last of our country speakers. She's a cash cap advisor for LAC, and she's going to be supported by Celia Gonzalez because she's on leave. So thank you very much for being with us today, Jimena. And I need to put your slide up. It's coming.
Hi, do you hear me well?
Yes.
Yes.
Gonna go back.
Okay. This is how much I care about social protection. So taking the time of the 6 minutes, the idea was to answer to your question, Valentina, why should humanitarian carers about social protection? I think in Latin America and the Caribbean, like from now on, we can, I don't think that we can afford not to. LAC face increased humanitarian risk due to heightened exposure to climate-related hazards, such as floods, cyclones, and droughts. It is the second most prone region to climate-related disaster, as well one of the regions with the largest migrant populations. So being guided by the 3 questions you provided, I was thinking, in terms of from a regional perspective, how was the social protection system leveraged, coordinated with? Well, it's important to clarify that well, of course, each context is unique, and the landscape has to be observed, right? I think that inflection point was Ecuador earthquake 2016. I think that's the moment when we started to see different. And the coordination has been progressive. At the beginning, we were only engaging with social ministry and humanitarian actors, right? But I think that the more we learned, the more we understood that financial ministry, environmental entities, and National Disaster Management Office had to be engaged. And this has been gradual coordination, right? And trying to thanks to a lot of agencies that have proven to have a lot of evidence and showcase the increasing role on social protection in DRM, and strong governments, Chile, Peru, Caribbean countries and territories, Ecuador, Colombia, Argentina. So I think that there was a lot of potential to unleash the role of social protection in this realm. However, of course, there's a lot of challenges yet, and you have a lack of coverage, you have normative frameworks that are not adapted, you have lack of coordination among ministries, roles assigned to social ministry during acute shocks that are more related to recovery stage than that emergency, like on financial mechanisms that might be adapted to this time, right? So this, we observe that these linkages between social protection, because it was weak, and this was going to undermine the linkages between humanitarian actors, right? Because these humanitarian actors tend to feel more comfortable in the DRM realm and in Latin America, right? And in terms of ownership, I was hearing really interesting reflections about ownership. Yes, definitely, of course, national ownership here is for granted. However, each ministry dynamic is unique, and also we tend to observe that even though agencies were doing a fantastic job showing it was effective, the incentives to collaborate were not there yet. Bilateral agreements were still happening a lot. So, and fragmentation and silos also. So our contribution was trying to tweak this incentive, bring collaborative exercise, trying to build the case with different workshops, simulation exercise methodologies in order to bring the DRM realm into a social protection landscape. Celia's case, for instance, that she will bring her insights in the open discussion. She's embedded in social ministry, but with collaborative deliverables, peer-to-peer support, mentoring exchange that we have with UNICEF, for instance. So the difference, I think, it was long-term engagement. It's totally different to work like this. You have to really switch the way you engage with regional bodies, with humanitarian partners, with social ministries. And the third, I think the third reflection, it's a bit taxative to say it's better. I think that it's unfair because we haven't, from a humanitarian perspective, we haven't given the level of investment and patience to this model yet that we have done to other models. So I think that we should continue investing in this, showcasing evidence, collaborative ways of working. And I leave the reflection on the role of civil society, right? On the role of civil society, I think that from my perspective, this is also one level of investment that we should promote for linkages. Yes, government is the duty bearer, but the role of civil society, definitely it's huge. It's a citizen engagement, and that's an opportunity for also for humanitarian actors to strengthen. So I also, leave the question to all. Why also should social protection actors should care about disaster risk management, and why social protection actors should care about human mobility? That would be my 6 minutes exactly.
Fantastic. You were spot on. So thank you for being such a champion and for flipping it around in terms of not why should we, but why not, and kind of looking at the fact that because we can't not be engaging with this if we want to think sustainably and towards the medium term. And I'm going to ask Karis to just close us off. And Karis is Regional Social Protection and Nexus Officer for the ILO, and she'll just be kind of looking across everything she's heard, and obviously with the MENA focus. I'm gonna, let's see, can you see her? Yes, you should be.
Thanks. So I've taken loads of teeny tiny notes. I hope that I can go through them coherently. But I think just two main reflections maybe. Firstly, it's interesting that obviously social protection systems have been used in lots of contexts. For instance, themes around government data and the use of social registries or MIS to enable responses, or the importance of coordination. But the notes that I was taking here is, if we're all in agreement in this room and online, then we really need to be thinking, like, why are there issues at country level? Because I come from kind of different country context background. Why are we still facing issues at the country level? Is it that we just have specific actors in the room now? Or perhaps the implementers in country are different to the policy people who are at this conference? I think it's probably more interesting on who answered yes or to the myths, as opposed to the majority of us who are perhaps in agreement. And maybe for us to consider in what case are these myths true or false, whichever way around. And in using the counterfactual and then working backwards from that would maybe help us, if we're all in agreement in this room, to convince the wider humanitarian population that perhaps are not in agreement. So that is my kind of larger reflection from just being here. And then I just also wanted to kind of take a step back and say, based on our experience in the MENA region, why humanitarian actors should care about a broader, more holistic approach to social protection. So I think lots of this has already been mentioned, but the way that it builds resilience ex ante in populations. So I think you had on the slide about it being the most anticipatory of anticipatory action. And I think here we're not just talking about social assistance and cash, we're talking about a range of instruments, so social insurance services, social health protection, employment as well. So in the region, for instance, in Jordan, we're supporting refugees to access social insurance alongside employment opportunities. And I wondered in Ukraine what proportion of the government response was actually linked to contributory systems, not just the kind of humanitarian cash, social protection cash that we normally think of. And also, I think humanitarians should care about this broader holistic approach to social protection in terms of exit strategy. So I liked where I think Hashim was saying that national actors will remain even when the humanitarian response ends. They're also often the first people on the ground before anyone else gets there. And I think social protection actors are inherently perhaps the most local of local actors, which we don't necessarily see when we're all in the room. I'm here in the room, not a local actor talking about it. So more holistic approaches would look at solidarity and financing and a social contract that is really negotiated by national actors on the ground that then is reflected through the social protection system. And I think the type of design also matters. So I guess transparent payments to categories, say on the life cycle approach, rather than just kind of narrow targeting, I guess, based on humanitarian need and about how to transition between the poverty targeting to these wider approaches. And my very final point is, I think that we're in this room now facing the context of USAID and other funding cuts. But even before that, protracted crises were the norm. I think 90% of appeals in 2024, something like that. So ultimately, humanitarian actors have to start thinking about national systems and other long-term solutions. And I think social protection can offer a good route to do that.
Amazing, thank you so much. So we're moving on. So let's give a round of applause to our speakers. First of all, Paris for being here just off maternity leave. Social protection for you. We're gonna, for our last part of the session, we've got 3 questions in the background for everyone. And you can go back to the Menti. For those of you who don't feel comfortable speaking out loud, you can also be uploading your comments anonymously. They'll be flowing up onto the screen in the background. So it's the same code, same Menti, menti.com 81688359. So I'm going to exit the presentation. Actually, before I exit, let me just remind you, since you mentioned social protection being the most local of local actors, that there's going to be a session on localization tomorrow looking at the role of social protection in that. So please do join that as well. I thought I had it on the slides, but it's disappeared. So let me put the Menti in the background for this, and let's open up the discussion. And the questions I have we have for you as an audience is, having discussed all of this and kind of heard our examples, is there anything that you would do differently kind of from how you're doing things now? Do you have any deep set kind of worries that are bugging you in terms of what we've been saying? What I'd ask you to do in general is to put on try and overcome your skeptics, kind of the skeptical side of yourself, to shift to a more believer mindset. So try and answer your own questions in terms of your skepticisms as you're joining in the discussion. One thing for those of you online, if you can also use the chat to write things, and we'll have Rachel and others help to bring the chat discussion kind of with a voice to the room. So anyone in the room want to come in as a reaction to what we've been saying? Yes.
I just written it up there. It's like the nexus of humanitarian response. Social protection is the nexus of humanitarian emergency response. It's where the humanitarian response meets and can facilitate and develop and strengthen a system, by piggybacking on that system. And also, when registering for beneficiaries for your programme, you can also facilitate social protection systems if you use a sort of national, if the government is trying to create a register, donors can help facilitate that process, which will then enable households to perhaps in the future benefit from social protection, but can be a win-win for national registers.
And it's not just piggybacking on those systems, it's also thinking what within those systems that could benefit from my expertise, from my lens, from what the hundreds of tools that the humanitarian sector has developed in terms of kind of understanding risks, in terms of triggers for kind of addressing specific hazards, and how we can be building that into a system. That there's a lot of capacities and knowledge from the humanitarian sector that can be handed over. There's a lot of kind of understanding in terms of feedback mechanisms, grievance, kind of accountability to affected populations. Very often is something that the social protection sector does, but maybe putting less money behind it. So that there's a lot of complementarities that we can be thinking about. Anyone else? Tim.
It's wonderful to see how far this has moved, actually. I mean, I was in Ethiopia. I was involved with the design of the Productive Safety Net program, and that was kind of a point in time which we didn't even realize, really. I mean, what we've been struggling with in the past, I think there are three different kind of worlds and contexts, and one is the social development world, which is the disability allowance under 5 and everything, which I see as sort of ILO's world. Then the humanitarian principle one is the one that Paul's been talking to. In Ethiopia and in Kenya, to a great extent, with Hunger Safety Net program, we were coming from a food security, poverty and vulnerability lens. And it wasn't necessarily core humanitarian. It was trying to help people who we knew when they needed assistance, where they were, who they were, and we were using the NDMA in Kenya, for example. And there was a real sort of political banging together, and there wasn't much sort of forming. I think my other comment from listening to this is that back in the day, it was in a very food insecure, fragile context, but it wasn't in conflict. Now what I'm seeing now, which is the big step in, is that these sorts of systems are being put in these really conflictual, and that to me is the big wow, actually. So Yemen, Ukraine, sort of Gaza, Palestine, it's amazing. And so I would say it's come on in leaps and bounds and can continue. It's amazing. And the other reason I got into it was the cash transfers as well. We were trying to stop food aid, and we haven't really succeeded in that if you look at Ethiopia. But so it's becoming a cash first mechanism, and to me that is really important as well.
Fantastic. And thanks, one, for bringing the institutional memory, and to give us, I think, kind of everyone, even those kind of listening in online, are part of the people who've been helping to move things forward. And it's each and every one of us that can play a role in that. So we saw Maria Jimena as her kind of NORCAP hat, cash cap. She's been able to influence and sort of do capacity building and sort of work regionally to be pursuing this. People kind of sitting in country offices, whatever hat we have kind of sitting, we can be engaging. And I think that's sort of an empowering message. And the reminder of how we've succeeded to some extent on the cash transfer discourse. And I think it's encouraging that maybe this is the next one that we could be winning. That's why the high level panel was convened, is to kind of have a collective stock take of the fact that this is happening. It's good that it's happening. There's evidence that it's actually, again, value for money. It's so let's kind of keep on pushing in that direction rather than going back in time. I don't know, Paul, if you wanted to.
No, let's keep
Yeah,
the floor open.
keep the floor open.
I've got one point to make
Yeah.
at the end.
And I'll do two more from the room, and then I'm going to switch to the online and what's appearing here on the screen. So one and two. So you first.
Thank you. My name is Christian Flash. I come more from the social protection side. I was following very eagerly the presentations, and it was very interesting. And what I kind of take home is in order to link humanitarian work and social protection more, there seems to be the issue of lacking awareness by the actors, lacking coordination by those who should coordinate those actors. And then I also liked your point about anticipatory action. I'm not from the humanitarian side, but I'm pretty sure that many humanitarian situations, we know which areas are prone for flooding, for droughts, for climate disasters, for conflict. So, I mean, Ukraine might be an example, an exemption there. I don't generalize there, but these points can be taken. And I was wondering, how can this be taken forward in order to raise awareness and in order to strengthen coordinators? And there is the question of capacity development in that area. And I was a bit wondering, there are so many ILO folks in this room, and nobody was mentioning the Transform training. So it's a flagship training on social protection from ILO. It has even a disaster response, a shock response module on social protection, and it's available in Arabic and in French and in English. And I was wondering if this could be, I mean, it doesn't have to be this training, but there are things in place which are exactly addressing this point. And I just wanted to throw this into the discussion and see what happens. Thanks.
So thanks for touching on that. So Momin Badar.
I'm a Transform trainer, by the way.
Momin is also a Transform trainer. I was involved in developing the Transform training, so I'm very glad that that is something that is, and there's a lot of other trainings out there that have been developed, and maybe just, again, collectively thinking about how we could push those further towards, sometimes it's more the I feel like those who came to this session are those who are already interested and already think this is important. So how do we preach beyond the converted? I think that's the real question that we all need to be asking going forwards. But
hi there.
Hi.
Hi everyone, my name is Michael. I work for Give Directly. We're a cash transfer NGO who work across humanitarian and development space, including with some national governments on social protection. I had the fortune of being in some of the meetings that people have referenced today, so the forum in October and the SPIAC-B workshop in January. Yeah, a lot has changed since then, to put it mildly, in the ODA space. I'd be really interested in the panel and your reflections on what we've heard today, like how we frame this within the debate that's going on at the moment, and how you make the argument for everything that you've outlined. Maybe a lot of this is like preaching to the already converted in here, but there's a lot of things on people's minds at the moment. I heard a very powerful argument, particularly from Ukraine, on cost efficiency, but maybe a counter side would be that donors quite easily equate social protection with large cash transfer programs, and they may not be willing to put years worth of funding like they used to do. I say that having been at DFID and FCDO before joining Give Directly. So I'd be really interested in how people, what's changed and how to frame this argument within the sort of the challenge that we're all facing now.
So quickly on that, luckily the high-level panel will be going forward with FCDO funding despite the cuts, because that kind of will be one of the key things that we're going to be trying to argue there. But we did a webinar on kind of on the USAID cuts and implications for social protection, and what's been happening up to now is social protection systems have been resilient to the cuts because they are nationally owned, nationally led. They haven't been affected by the cuts as much as any other sector, and definitely the humanitarian sector. But let's remember that they could be affected with many ripple effects, and that's something that we really explored in the webinar and in accompanying blogs. And there's a big question mark around whether the World Bank will also be affected, because if the bank is affected, that would be a massive hit for the social protection sector, which received almost no US funding because US wasn't keen on giving money to national system strengthening. They wanted to be having their mark on things. So humanitarian cash transfers and humanitarian food transfers were more appropriate for that. FCDO 40% cuts to ODA does kind of have implications for social protection, but not as much as you'd expect, because it's not a very financed sector. ODA actually gives very little money to social protection compared to any other sector. I mean, so the whole myth, there's a myth also around social protection having a lot of money because it's development financing. No, that is not true. That's why domestic financing is so important, and that's why going at the source of where the financing problem lies, so that the debt problems, kind of some of the kind of global tax havens, etc., need to be addressed in the background to have more domestic financing for social protection. Shall we open to online? Rachel, I don't know if there's any comments online, or if you want to comment on any of these that you see here popping up on the screen.
Yeah, I just thought I would pick on a few of the comments that have been going on while presentations have been happening that have just been really interesting. There's one that's come up multiple times about the core issue really isn't whether humanitarians should and can cooperate with government, but who has the overall authority to make the decisions for humanitarian response. Is it OCHA? Is it like the resident coordinator? Is it ICC group? Who and when is it appropriate to make that decision? And what are the consequences if the decision makers fail to reach consensus? So it's really about that coordination and fragmentation across different actors, different players, and it's inherently, obviously, political. So it'd be really interesting to think about the practicality, the challenges, the practicalities of actually getting this done in terms of the coordination and collaboration part. Another thing that came up is the speed of social protection response very much depends on the normative and the financial frameworks in a country. Particularly, just a moment ago, someone was raising the topics of displacement, mass displacement, particularly refugees. The notion of working through governments or trying to sort of integrate responses is not so straightforward, and you can have huge exclusion problems there. So does the panel have something to say about that? And I guess the last one I'll just pick out now, there's a lot of interesting stuff there, is about really when is it, are there, instead of saying, yes, it is possible, it can be possible, these are definitely myths, we all agree, but often it just doesn't happen. And when is it not possible to work with governments or through governments? If, for example, in the Tigray crisis, we saw that in Tigray specifically, it was impossible for a while, yet in the neighboring regions of Amhara, it was definitely possible. So looking at the context, particularly of conflict and crisis in relation to the extent to which you can have that coordination. But anyway, these are just things to raise for us to think about.
Fantastic. Does anyone online or in the room want to react to that, or want to come in with a voice on that or anything else? I have a hand in the room. Yes.
I just wonder if SPHERE or CHS could do anything. You know, is it already mentioned in the SPHERE? You know,
the SPHERE hardly mentions social protection at all. It's like I've
they're here. Speak to them.
Yes. and they've just been going through the sort of updates, and it's really not there. And I can tell you that even in engagement in the SPIAC-B, I mean, it used to be under Grand Bargain, now it's SPIAC-B. It's tough because there's many things at play in terms of historical mandates and institutional roles and who holds what. Again, it's the power to decide in some cases, and those are difficult incentives to change because yeah, there's a lot of gripping on to power. Just to be blunt. Paul, I don't know whether you want to add anything on that.
No, I've got like 3 final thoughts. So
Yeah.
we give those.
Vale.
Yes.
Sorry, Tom and Juliet and Carla had their hands up in response to some of the things I was saying.
Yes, yes, and let's do that before Paul. Fantastic. Just unmute and speak.
Oh, hi. Yeah, this is Tom Burns speaking. I just wanted to reflect on that last point, which was, on the challenges of, of Tigray, where you have the government party to a conflict and then other parts of the country which aren't. And I think that's a core issue that we have here, where we all say, the ability to engage with humanitarian and social protection is on a spectrum, but the humanitarian coordination system is unitary. It only normally is one for the country. There's one humanitarian coordinator. In Ukraine, it was very challenging, where we'd say there was no issues working in Lviv or Kyiv with government systems, but in recently liberated areas of Kharkiv or Kherson, there could have been massive issues related to collaborator laws and other elements. And so again, I think that's an element of where we recognize that it's context specific, but many countries, there are multiple contexts, but the humanitarian system is quite simplistic and doesn't really enable that reflection. So how do you say easily to humanitarian coordinator, yes, we're going to piggyback on the systems in this context, government, but we are not in this other part of the country. And I think that's a political challenge that hasn't really been, we fully get grasped to. So I just wanted to reflect on that. Over.
And from the social protection perspective, it's about having the capacities, working with conflict advisors and people who can help you to understand that, because that expertise is lacking from the social protection side, which is why some of the agencies, that's why UNICEF is now looking at kind of what are the specificities of social protection in conflict settings, and same with the World Bank, because that expertise is lacking. And again, there's complementarities and expertise that we can be bringing in. 2 more hands up from the audience online. I'm going to over to you online. Yes. We can't hear you.
I think it's because we're all being hyper polite because we don't know who put up their hand first.
Yeah, don't worry, go for it.
But luckily, we all know each other, so we're hopefully not going to take offense. My name's Juliet Lang. I'm just going to reflect on maybe 2 or 3 things, because I think that as a coordinator, and I think that coordination frequently comes up in terms of these discussions, and I found the last point that Tom made also very interesting, because it is true that when we talk about the need for coordination or strength in coordination, we all mean different things when we talk about coordination, right? For some, it means coherence. For some, it means complementarity. For others, coordination is a much more encompassing idea. And also as well, in any situation, it's true in the humanitarian system and in the development system, and indeed in the government-led systems, there is not always coherence as to who can take a decision on behalf of the wider group. And that's true in the humanitarian system, and it was touched on in the chat, but it's also true within the ministries. Ethiopia keeps being bandied around as a reference. There are multiple different ministries dealing with different parts as well. At times it can be very difficult to know who and where you negotiate with. So that's just kind of one thing I wanted to say about that. And then I just wanted to say 2 final thoughts on the idea of the humanitarian reset and some of the kind of conversations that come up. I am a humanitarian who is excited about social protection. I am really excited about the idea of it. And I think particularly in a time where we are going to have to pull back towards intersectoral severity 4 and 5, which is really fixating in and prioritizing in on what we can do as life-saving as humanitarians, is also a time where we need to be a little bit more clear about what it is and that dialogue that we open with national authorities to talk about an intersectoral severity 3 that may be kind of economically insecure and left vulnerable. And how do we coordinate and collaborate with social safety nets, et cetera, et cetera. So I am an actor who is excited about that. But my final thought is that the premise of this conversation was, why should humanitarians care about social protection? And I think it is incumbent upon all of us to remember that all of us come with our individual limitations and things like that. So starting a conversation by saying humanitarians hide behind their principles in all contexts is also not a conversation it's not a good place to start that dialogue or that conversation. Because, you know, Ukraine is a great example. And I think that, you know, the work that Perihit has done has been amazing. But the stat that I always gave was that the invasion was on the 24th of February and the first list was received on the 15th of April. I get that you think that we're hiding behind our principles, and I have much to say about the lack of coordination inside of the IESC system. But I would urge you to think about what were we supposed to do between the 24th and the 15th of April, keeping in mind that even on the 15th of April, that list was only released to a small group of people. So again, it's sometimes, you know, this idea that you're hiding behind your principles can come across as quite kind of confrontational. And instead, is it better to start a conversation by saying, there are reasons why all of us have to get to that point. What are the questions that you need an answer to? What are the answers that may exist? And how can we best start to come around those? That's it from my side. Thanks.
Thank you so much. And I'm really sorry we actually missed you at some point in the middle, but I think the key points came across. And we're almost at closing, so I'm going to swiftly kind of, if you could keep it in 1 minute, Celia and Carla, and then Lucas, and then hand over to Paul to close.
Okay, I will start then. You name me first. Yeah, I would just like to point out from the experience in Guatemala that I found really useful to work with a bottom-up approach in terms of collaborative processes, because many times it's not a matter of not caring about linking with social protection. There are NGOs here that have tried to link with social protection since long time ago, and they have not reached the point where the ministry had an interest on linking with them neither. So sometimes it's not a matter of not caring about it, but not finding the correct spaces to have the discussions. And I think this is important because it's not always because of a lack of interest or of a lack of understanding. In this case, we found it very useful to create collaborative processes with government and humanitarian actors, at least to have a common language and start to have some common agreements. But even with that, it's a very long-term process, and it needs to build trust, and it needs a lot of political willingness. So I would also like to point out that because sometimes we might think it's just because we are not caring and we prefer to work in parallel, but it's very difficult to find the space to. That's over from my side. Thank you.
Amazing, and it reinforces that putting ourselves in each other's shoes concept that Juliet was stressing. Carla, over to you, super fast, and Lucas.
Thanks, and yeah, just to apologize as well for not being for not being there in person. Just say great discussions, and I think just a couple of things. One is on the coordination. I think what Juliet mentioned obviously is an important point, and I do think it is about being in each other's shoes and no principle being above the other, because at the end of the day, we are all about human sort of rights and humanitarian principles. I think, though, in the case of Ukraine, just to mention, we could have done, you know, perhaps not Ukraine, but in Palestine, for sure, we could have done better preparedness as well. In many places, we could do better preparedness and have data sharing agreements in place beforehand that allows us to then be able to do data sharing and be able to complement social protection systems, at least in the West Bank, Gaza. Okay, that's a more complicated issue, but for sure it would have enabled us to do things much faster. So I think there are nuances to those conversations here and there. Two more things to say. One is that I do think that on the coordination, it's also about the UNCT and the HCT talking better to each other, enabling the resident coordinator's office to really enable coherence, for there to be from the get-go a country strategy plan that looks at humanitarian responses and development response that use the instrument of social protection where that's feasible, where that's possible, and where not. How do we lead towards that so that there can be sustainability in the future? And then finally, it's just a plea to action. I mean, I do think that this is a really good momentum. We're having a really great conversation here in the HFPW. Could we draft two things? Could we draft a letter to the ERC perhaps and crowdsource it with some sort of key points that we think would be critical for the humanitarian reset to consider this issue, the issue of linking with social protection and how to do so. We have so many very practical recommendations from everyone in the room and online and people that have been working in the field. I think we could do it easily on a 2-pager. And then perhaps even to plead for an ISC guidance at some point, because the SPIAC-B principles are great, but they're not seen as, I don't know what the word is, but legitimate enough or whatever it is. They're super useful, the tip sheets. But I do think some ISC guidance that people really feel that they would need to follow. And likewise, from the development side of things,
I'm going to have to, because we're beyond time.
Thank you. That's all.
We fully agreed on that. And I saw Charlotte say in the chat that there's good news on the SPHERE standards, maybe incorporating more on social protection. Lucas, 30 seconds.
I will be super fast. I wanted to continue a bit on what Juliette was saying. To me, it's more, it exists on a continuum, right? And it's a question of understanding that the social protection system is part of the context, and then we analyze it, we should understand it and see what it is good for. So it doesn't have to be fast, but it can be fast enough, or it can be made fast after initial acute phase, or it can be specifically suitable for addressing specific kinds of needs or for specific vulnerable groups. But we will never know unless we actually decide to understand it in the beginning. So and that's for me the learning also from Ukraine, that before we kind of got things together and understood we need a dedicated instrument to understand things, a year has passed, year and a half has passed, and that's just too slow. We need to be much faster at this in the beginning. That's it. Thank you.
Let's not complain that it's broken. Let's understand it and try and build it up to do what it needs to be doing. Over to Paul to conclude.
Yes,
and let you go.
I had 3 final points. I started on answering Michael's point. I think, reframing, it's partly about sort of ways in which sort of working with and through national systems can be efficient, effective, and help to sort of weather the storm. It's partly about sort of a shift of thinking about domestic financing and the ability of governments to invest in their own social protection systems, sort of lessons from COVID in what state actors can do when humanitarian, international humanitarian action is less there. In response to the point about ILO, it's one of those two-way things again. I think, yes, humanitarians could all sorts of great resources. They should engage with ILO more, think about what ILO can offer, think about what trainings they can take place. If you had to characterize ILO's engagement, fragility and conflict and violence over the last 20 years, you'd probably say a bit pat. And so we want to encourage ILO to do more on fragility, conflict and violence, which it's starting to do, and that would be great. And then a final point, picking up, I think, on what Hashim and Momin were talking about in their presentations. There's a tendency, and I fell into that trap when we're talking about sort of interlinkages between humanitarian action and social protection, to focus on payments and to think about sort of humanitarian cash and how that should link with social protection. That's an important part of it, but it's only part of the social protection system. And the big linkage I'd like to see more of is links with humanitarian protection and social protection, because humanitarian protection is about thinking about all the ways in which people are vulnerable and ways in which people need to be supported, which is what social protection is about. And that happens in part through case management and social workers. And those linkages, I think, are really important. No one suggests sort of continuing to support a whole system through crisis without thinking about doctors and nurses. But we managed to think about sort of providing assistance to people in crisis without thinking about social workers and the social protection workforce. So I think we need to do both. And that was the final thought.
Fantastic. Thank you all for being so patient at this time of day, and hopefully you can help to preach to the unconverted to kind of moving forwards. Thank you. Bye, everyone. Thanks to those online.
Thank you so much, Bravi. Ciao.
Thank you, everybody. Bye-bye.
Remember the resources. There's a lot of resources that you can be accessing. A lot of them have been shared in the chat as well. The tip
Thanks,
sheets.
everyone. Yes, we'll share them also via email with all those who registered. Thank you, Valentina, Paul, and everyone in the room.
Bye.